So we're here today with Dr. Uday Devgan, who's a cataract and refractive surgeon in Los Angeles. Welcome.
Thank you.
So in light of everything that's going on with the COVID-19 pandemic, when do you see the light at the end of the tunnel, and what are some of the challenges in bringing ophthalmologists back to work?
For sure. There's a lot unknown here. And one thing I'm always reminded of is we know as ophthalmologists, no one knows the eye better than us. Well, no one knows infectious disease better than our ID or infectious disease specialists. So I'm not trying to be an ophthalmologist who's predicting ID outcomes any more than I want the ID doctors to do ophthalmology. So I'm relying on my colleagues, relying on our leaders, and following their directions. And that means my cataract and refractive practice, which is purely elective, is totally closed. And that's a tough thing. But I also spend a large portion of my week teaching the UCLA ophthalmology residents at a large county hospital. And we're still open for emergencies and truly urgent cases. And because so many of the doctors in the community have closed their satellite practices, all those patients get shunted in to our county teaching hospital. And we're actually staying reasonably busy. Elective visits are obviously way down, close to zero. But with urgent visits, there are a few surgeries every week, and there are a few patients coming every single day. And these are things like a ruptured globe, a perfed cornea from an ulcer, acute glaucoma cases, retinal detachment for our retinal colleagues. We even had an endophthalmitis referred in. So we're still keeping our hands wet with those types of cases. But where this will be in the future, gosh, I've never been great at predicting the future, but I'm pretty good at adapting to it. And maybe that's the more important characteristic during these times.
Mm-hmm. Okay. And what do you envision being the new normal for the practice of ophthalmology?
I asked myself a simpler question to judge that. And my question is, for me personally, when do I feel comfortable going back to have dinner and a movie? Go out to a restaurant, have a nice dinner, then go see a movie, and then come home. When would I feel comfortable? Well, certainly not this month or next month. And it may be quite a few months down the road. It may be towards fall or even, winter this year. And that's going to really impact as well our ophthalmology practices, particularly for the elective surgeries. Mm-hmm. I mean, in all of ophthalmology, the number one surgery is cataract surgery, almost 4 million done last year. And that number is going to obviously take a hit because that's a purely elective surgery. You can't justify exposing a patient potentially to the virus just in order to do their cataract surgery when it's not a threatening problem. You can wait 6 months or even longer with impunity. There's no downside in waiting. So I think we're going to have a slow time coming back with our practices. We are having an opportunity for new technologies. There are a lot of people who've developed smartphone eye exams. So obviously patients can take a close-up photo of their eye, and the new cell phones do a really fantastic job of these macro images with better lighting. And that's certainly helped for external disease. But there are even apps now for doing a refraction on your phone. Mm-hmm. And I think it's not too long before we have adapters for phones to be able to take a fundus photo. Mm-hmm. Now, obviously, at the end of the day, to do important things like measure someone's pressure in glaucoma, do a procedure, an intravitreal injection or a YAG laser, you have to bring them in. But perhaps for some of our patients, we can really make use of this telemedicine and help them remotely.
Yeah, sure. Let's circle back to a little bit about the elective surgery. So how would you reassure patients who are a little bit nervous about, coming back for an appointment with this after this?
I'm not sure there's anything we can do to completely reassure them. It's like a movie theater trying to reassure me that, no, it's all good. Come back. We have a great air filtration system. We'll hand out free masks. I'd still probably pause a little bit. And remember too, particularly with cataract surgery, these are patients who are older patients. There are very few cataract patients under age 50. The majority are over age 70. And they often have comorbidities or other medical problems that put them at a higher risk. And I think those patients are going to be quite cautious. We also can't discount the effect of the economy is having on all this. When our patients have, like me, obviously a huge drop in income. And maybe the patients can't afford some of these elective procedures, whether it's a premium IOL or laser refractive surgery. And I think those may take a hit too. But again, the only thing is time will tell. We got to just take it one day at a time. Mm-hmm. Use this opportunity to give yourself a mental reset. Also to clean out the garage. I've done that really well. But the mental reset kind of helps you understand what's really important in life. You know, I used to always joke with my kids that I only work half time because I usually work 12 hours a day, which is only 12 out of 24 is half the day. Mm-hmm. So that was my joke, that I only work 12, half time for this 12 hours. But maybe there's something more important than that. To have my college-age kids home from college doing their remote classes, and I get to have a family dinner with my kids every night who are now young adults themselves, that's a pleasure. Mm-hmm. There's a whole family, we do walks in the evening, take the dogs out. This is a different time, and we gotta accept the bad of it, of course, but also understand that there's good in this as well.
Mm-hmm. Embrace the positive of it all.
You gotta roll with it, exactly.
Yeah. So, it's a great thing that we're in such a digital age as we are. What technology do you think will best serve us going forward, and what are some areas where we really need something developed, a new innovation?
Well, for almost every patient now is going to have broadband, so fast internet connection, have a laptop like I'm using now that has HD video, so the quality of the video is superb, and we're able to see a lot of details very close up. So I think a lot of the routine stuff, let's say the blepharitis, the allergic conjunctivitis, the itchy burnies, some of the mild dry eye, maybe we can treat all this remotely and prevent having the patients come into the office. Now, obviously, limitations are you're missing a lot of the eye if you're using the external part. To be able to examine the optic nerve and the retina, to use our fancy machinery in the office, to do an OCT exam of the retina or of the nerve fiber layer, mm-hmm. to measure the intraocular pressure, to administer a medication. These are tougher things, and these are still going to require patients to come in for visits. Mm-hmm. But I think in certain practices like retina or glaucoma, where it's not truly elective, these patients have to have their treatments to prevent losing vision. I think they'll have less of an impact in this downtime than the purely elective, either cataract refractive or, let's say, oculoplastics cosmetic. Mm-hmm. Those are going to take a much bigger hit. But sure. I think we're all able to weather the storm and try our best to help patients in other ways. And for me, that means spending more time with my residents at the county hospital and doing all kinds of neat cases I didn't think I'd do for quite a while.
Well, that's true. And speaking of, downtime and making the most of this, and especially in light of conferences being canceled as a result of the pandemic, how are ophthalmologists, continuing their education, and how can residents continue to receive their education? What are the unique needs there?
Really great question. So we're continuing with the resident education. I host a 4 p.m. cataract conference every Thursday for my residents, presenting video of cases, discussing it. And we've had really great turnout of our residents, probably 75, 80% of them calling in and using this video conferencing. They also continue the rest of their education, their didactic stuff. So the residents have kept up with their education. In terms of international ophthalmology, I'm actually part of a multiple symposia. One is coming up this Friday, which is hosted by doctors in Brazil, and I'll be participating with that, which is really nice, not having to get on a plane. There was one last week that was coordinated from India that had 500 ophthalmologists on it. And I even have my own project. I have a website called cataractcoach.com. I actually published a new teaching video, only 5 minutes, fully edited, fully narrated, a new video every single day for the last 700 days, and I've never missed a day.
That's great.
Yeah, so there's certainly no shortage of fantastic material out there. Even I was studying some glaucoma videos on YouTube, because now with these emergency glaucoma cases, I'm doing more of these. So I wanted to learn some of the newer techniques. And there's a lot of great information out there. So I think just a simple Google search or YouTube search will turn up a lot of videos that can really prove very useful.
Mm-hmm. Okay. Is there anything else that you'd like to add, just in light of an encouraging word for ophthalmologists in this current environment we're in?
Again, hang in there. It's going to be okay. Let's trust our ID infectious disease colleagues. They know way better than we do. Let's help patients in any way we can. And let's enjoy having more home time and family time. And yes, don't forget, you got to clean out the garage.
All right, Dr. Devgan, thank you so much for your time today. We really appreciate it.
My pleasure.